YouTube Live is working. We've been having troubles with the internet in past attempts to make this work from home. So I'm really glad that this is working. So we're doing one in the evening here, and I put the title as Discharge Instructions. That's based on an article I just read out of, I think it was American College of Emergency Physicians, their journal, that talked about how it's very important to get people to understand instructions when they leave the hospital or the emergency department, and I guess it applies to the doctor's office too, because, oh, look, who's making a guest appearance? Everybody's favorite, Lisa.
Hi.
Thank you.
Hi.
She'll do things.
I'll dance for you.
She'll dance for us.
I learned the worm.
She learned the worm. That'll be one of those things we have to use. What's it called? Super chat for, if you guys want to see those. Let me adjust this here so you guys don't have so much light going into the lens. And of course, we are open to chat. Let me make sure I can see it if it happens, because I haven't seen any chats come through yet. So you guys are certainly welcome to participate in the, oops, the camera's moving, participate in the conversation. And if you have stories you can share with us about experiences of not having clear instructions when you left the doctor's office or not understanding how to take a medicine, that would be exactly what this article was talking about, saying that we're not doing all that good of a job in medicine at getting the instructions so that patients can get better after they go home. A lot of them aren't even, I think it's 30% of prescriptions written in the emergency department aren't even filled by the patient. So it's kind of hard to get better in a timely manner when you're not taking the medicine that was prescribed. And there's lots of reasons for that. One of the things that focused on was language. That's part of it. Another one was resources, like if you can't afford the prescription, not able to. Another part of it was following up with a primary care doctor. Well, if they don't have a primary care doctor, or if it's hard to get into one, that's of course hard. So we're looking for any comments. Oh, I'm sorry, there have been comments. I'm missing them all along. So Pam says hi to both myself and Lisa. Thanks, Pam. And Hannah Banana, hi. Lindsay Antoine, there you are. You're finally free to be here for the whole video. No work, no homework. Oh, thank you, Lindsay. We're glad to have you be a part of it. Kenzie, hi. And Petra, hi, doctor, from South Sweden. Wow, it's late there. And Baccio Chiba in Japan. I guess it's a little bit earlier there. And then who else do we have here? If I can just pull up Crystal. Hi, Dr. Vaughan. Often I've been given printouts upon discharge that are contradictory to the physician said. Oh my goodness, that is not cool at all. So I'm sorry that that's happened, Crystal. That's exactly the sort of thing we're trying to improve. Try to keep things like that from happening. Here, I'm going to try to tilt this again so that you guys can see me without all the light coming into the lens. So yeah, that's exactly it. Contradictory information. And you know what? I could very well be responsible for that myself. I think about how I do discharge instructions. I'll do a little search on the electronic medical record, and oh, there you guys go again. I guess I'll leave it like that. I'll do a little search for discharge instructions related to whatever the diagnosis is, and then I'll just put it in without reading it necessarily, because it's sometimes a couple pages long, and there's some time pressure, like there is in a lot of environments in medicine. So we'll try to do that. Okay, so let's get caught up on some messages here. Petra is saying that it's 4:23 a.m. and she just got up. Again, that's in Japan. And Christina is in Ontario. Thank you, Christina, for joining us. Let me adjust this a little bit here. Okay. So there we're going to, well, we'll go ahead and leave the chat on. I was going to turn it off for a moment. Well, I'll leave it on because you guys have good stuff there. Oh, I'm sorry, Sweden. AM. Yes, that's right. Because it's early in the morning in Sweden and it's late in the day in Japan. Maybe they even still have the sun up. So possibly. We'll move on with the topic of the day. Of course, you guys can present or suggest other topics if there's something that you're especially just thinking is the topic to talk about, something that's really timely, maybe because of current political processes in place with healthcare. Of course, I can give you a big fat question mark as to what's going to happen, because nobody knows right now what's happening at the national level. There's lots of proposals, lots of talk, but that's the problem. There's lots of potential plans, and not any specific one that's really being Confirmed. Okay, Pam, I had a strange incident. My hospital stay. Discharge instructions were clear, but discovered a month later that I should have kept them because my insurance wouldn't pay without, what? Very strange. Insurance would not pay without seeing your discharge instructions. And what I'm wondering is was that just they needed some kind of evidence of the visit, not necessarily discharge instructions specifically. Okay, and then let's see here. We've got somebody to put in a timeout. Hey, we'll do that. All right, so Pam agrees. All right, getting back to where we were. Almost 3 weeks. Wow, that's a long time to be there. Okay, so experimenting with the evening now that the internet's working at home. And also I did a really brief chat this morning or this afternoon at work. So trying to find what time works for me, because I want to be predictable for you guys so you know where to be and when if you want to catch these, rather than just having it be by chance that you happen to be in a place where you can watch it when it comes out. So we'll keep working on that. If you guys have suggestions for times that work well, let me know. We'll figure out what that would be Pacific time and see if that would work out on our schedule on this end. So we'll kind of look at comments one more time there. And, oh, we got more? No, we're at the bottom there. So at this point, we'll go ahead and wrap it up. We'll do it again another time. Until then, this is Dr. Mark Vaughan telling all of you to stay in good health.